It's Stroke Awareness Month, and I love to talk about being fast. You will see variations between BEFAST and FAST as the acronym to be able to think about how do I recognize in stroke and what are the signs. FAST is face, arm, speech, and time. And those are the signs of, in general, a large vessel occlusion stroke or a stroke in the middle cerebral territory, middle cerebral and artery territory, something that's going to hit the parietal lobe, the frontal lobe, the temporal lobe, those areas that are going to really show as kind of that classic picture of stroke. Facial droop, arm weakness, speech impairments, confusion, and time is really about recognizing the opportunity that we have to call 911 and we have to get help as soon as possible. Adding the B and the E, so both balance and eyes, helps us be able to understand the impact or recognize that some symptoms like discoordination, changes in vision, changes in eye function, or a loss of vision in one eye, all of those might be stroke symptoms, and we have to act just as fast. Adding the B and the E helps us recognize posterior circulation strokes. Posterior circulation strokes are tough because they can be just as severe and just as disabling, but score a 0 on the NIHSS. And that's because the symptoms are a lot more broad, a lot less specific, and a lot less focal. And so they'll give us things that might not be as obvious. And so that's an important thing. So being able to think about balance, eyes, or vision, face, arm, speech, and time are very important in the BFAST world. Additionally, sometimes you'll see T listed as time/thunderclap headache. And that's just a reminder that sometimes that headache or that worst headache of your life can be a sign of a hemorrhagic stroke. Because ischemic strokes don't generally hurt. They don't generally cause a headache. They don't generally cause pain, which can limit somebody's ability to recognize it in themselves. And instead, that sudden onset of a severe headache and the worst headache of your life can be significant for recognizing and getting yourself to the emergency room, calling 911, telling your family member, having them call 911 so you can get to the emergency room as fast as possible.